To continue my past episode, the first episode about fever in clinical practice, this is my second episode. So, to continue what I was talking about, fever, we have to understand that most of the cases of fever, they are infectious in origin, and most of the infectious fever, or what we call the fever of infectious origin, is viral in origin. So most of fever is infectious and most of the infectious is viral. So viral infections generally, especially respiratory viral infections, for most of the cases of fever, acute fever, which we see them in clinical practice, because most of the cases of acute fever, they are short term and they resolve over a few to several days, because most of these cases of fever, they are infectious, as I mentioned, due to infections, due to infectious agent, and most of these infectious causes are viral in origin, and most of the viral infections, especially respiratory viral infections, they are self-limited, and they are with short course and they resolve by themselves, even if you don't give the patient any treatment. But of course you have to give him or to give her a treatment, at least to alleviate the symptoms, especially the fever and the pains and the other symptoms associated with the fever and the pain, due to respiratory viral infections, which is the most common cause of or form the most biggest part of the bulk of infectious fever or fever of infectious origin, which is the most common type of acute febrile conditions. Of course, most of these cases, they are usually present with, or they are usually presenting with continuous or intermittent fever. Continuous or sustained fever means that there is elevation of temperature in the range between 0.3 to 1.4 degrees centigrade, and it continues throughout the day with this range, and with fluctuations around 0.1 or 0.3 degrees centigrade daily. When the temperature falls down to normal, this is, we call it intermittent fever. When the temperature or the fever spike drop down, but it doesn't go back to normal every day, this is remittent. If the range, this is the remittent fever. So the intermittent, it drops down to normal and then goes up again. The remittent, it is high and then goes down, but never back to normal every day. So here this what we call the amplitude of fever. So the range is between 0.3 of fluctuations around the day, is between 0.3 to 1.4 degrees centigrade at a daily basis. If the difference between the what we call the peak of the fever and the trough of the fever is more than 1.4, this is hectic. So hectic can be applied both to the intermittent and the remittent patterns. So the remittent and the intermittent patterns both of them can be hectic. If the fever spikes, they are alternating with days or weeks without fever, that is with normal temperature, we call it relapsing. So here in the relapsing, the interchange between the fever spike and the normal temperature period is days or weeks, not daily levels like the intermittent and the remittent. So the relapsing, there is intervals between the fever spikes and the other fever spike. There is an interval of normal temperature between several days to even weeks. This is the relapsing. So like that, we have to differentiate between the sustained, as I mentioned, or sometimes we call it the continuous fever, the intermittent, the remittent, which are interrelated, and the hectic, which can be applied to the intermittent or remittent if the difference between the trough of fever and the peak of fever is more than 1 degrees centigrade daily, 1.4 degrees centigrade daily. This is the hectic, and then, as I mentioned, the relapsing pattern. This is important in analysis of fevers, which help us in analyzing or pointing to the possible underlying infectious etiology, especially true in infectious cases. In some malignancies and some neoplastic sources of fevers, there is also sometimes special patterns like met with in patients with lymphomas, Hodgkin's disease or Hodgkin's lymphoma, and other hematological malignancies. They can show certain patterns of fever described in some reports in clinical practice. So this is not only to identify some infections or the fever pattern of some infectious causes, but also in some non-infectious causes, especially in some malignancies, especially in some hematological malignancies with special pattern of fever observed in certain populations. So when we analyze or when we manage a patient with fever, we should analyze the fever. Number one, this is very important. So the history is very important, the physical examination is very important, then the investigations, laboratory and radiologic investigations. Let us focus on the history. The history, you have to analyze the magnitude history of the patient. You have to analyze number one, the acuteness of fever, the duration of fever. This is in order to know whether you are dealing with or confronted with acute fever, that is fever of recent onset, or chronic recurrent fever, if the fever is persisting more than 3 weeks. And after being sure that most of the viral infections course should have been finished. So you should give a chance to exclude any transient self-limited viral infection, and to differentiate it from other rarer and more serious causes of fever. So at least 3 weeks with high body temperature should pass before we diagnose a case of what we call fever of unknown origin, or chronic recurrent fever, or pyrexia of unknown origin. So that's why the duration is very important, the acuteness of the condition is very important. And the course of fever is very important, and here to analyze the pattern of fever, which I mentioned them, continuous versus intermittent versus remittent versus hectic versus relapsing. So this is also from the history, and if the patient have any temperature or not, and whether this is measured by electronic thermometer or subjective method, which is, of course, carries a lot of errors. So this is important from the history. We have to ask for associated symptoms and signs. We have to ask for pain. We have to ask for general manifestations which are commonly associated with fever, especially night sweats and chills, that is rigors and chills. These are common accompaniments of any fevers, especially high fevers and fevers which are variable throughout the day, and with the use of temperature and with lowering of body temperature, sometimes rigors also occur. So rigors, night sweats, very important. Change in appetite, very important. Change in appetite, very important. Other gut manifestations, general manifestations like body aches, like myalgias, like arthralgias, like arthritis, signs and symptoms of arthritis. Also localizing symptoms like respiratory symptoms, any cough, upper or lower respiratory symptoms, manifestations of cold or flu, with runny nose, with nasal stuffiness, with sneezing, with nasal obstruction, with sore throat, with lower respiratory symptoms, shortness of breathing, cough, sputum, chest pain, chest wheezes, shortness of breathing, gut manifestations also, diarrhea, vomiting, abdominal pain. Urinary tract is very important, dysuria, change in the color of urine, renal pains, history of calculi or renal calcular disease or urolithiasis. Genital manifestations also, because some genital infections, sexually transmitted diseases might present with fever, especially gonorrhea and trichomonas infections and herpetic genital disease, which are common sexual or sexual STDs, sexually transmitted diseases causing fevers, and the gonorrhea is the number one and the most important. Of course, in addition to the rarer old disease, which is syphilis, which presents with also fever and with genital sores or chancre. So, of course, genital or extragenital. We know that syphilis affects the genital or can affect the extragenital areas like the anus and the mouth and throat and pharynx, etc. So we should check all of these points, symptoms related to the different systems which might localize the cause of fever, and if not, check for other causes of systemic fevers. Also, any skin rashes, very important. Any skin rashes, very important. Any lymph nodes, very important. Any change in the color of the eyes, jaundice and fever point to specific category of diseases related to the liver and biliary tree and viral hepatitis, etc. Jaundice, skin rash, lymphadenopathy, that is enlargement of lymph nodes in the body. Here might point to some systemic causes of fevers, infectious and non-infectious. Also, any organomegaly causing abdominal swelling. This is fever with organomegaly also will make us focus on certain category of diseases as underlying causes of the fevers. So these are all important. The history also important to ask about drugs, because some drugs can cause fevers. These drug-induced fevers. So drug history is important. History of smoking and alcohol consumption important. Alcohol can cause alcoholic liver disease also, and fever may be the presentation. Also check the sexual history. Sexual history for diagnosis of sexually transmitted diseases, venereal diseases with presentation as with fever. So sexual history and the history of sexual contacts and the number of partners and any contact with illegal sexual contact with unknown people who might transmit diseases to such a person. So here the sexual or sexual history important in analysis of fever in the history taking. And then we proceed to physical examination of the case. Also, don't forget about bites. The fever might be related to insect bite or to animal bite or to changes in the outside temperature, physical factors, chemical factors, exposure to chemicals, exposure to radiation, exposure to injuries by venomous animals and like snakes, like scorpions, like spiders, like unknown insects. So they might sting or they might bite and cause inflammation, and then this inflammatory process, as I will mention, inflammatory reasons is one of the causes of fevers, and one of the causes of inflammatory regions is due to animals and insects insulting the human body and injuring the person or the individual. So all of this should be checked in the history, and then proceed to physical examination after that. Next episode.